Namaskar, my name is Dr. J.K. Saini. I am Head Department of Thoracic Oncology and Chest Specialist SAG at National Institute of TB and Respiratory Diseases, New Delhi. COVID-19 pandemic has devastating effect on every aspect of the health, including HIV, tuberculosis, maternal and child health, malnutrition, but TB services are the most disproportionately affected with COVID-19 pandemic. Immediate impact of COVID-19 pandemic on tuberculosis was large global fall in the number of people diagnosed with TB and reported in the year 2020 and 2021. This decrease in the number of newly diagnosed tuberculosis patients led to the increased number of undiagnosed and untreated TB patients in the community that led to the increased TB transmission in the community that further led to the increased number of patients with TB infections and at risk of developing tuberculosis in the future. COVID pandemic, because of these increased number of undiagnosed and untreated TB patients, has led to the increased number of deaths related to TB globally. It has been seen that in the 3 years from 2020 to 2022, there were 5 lakh excess deaths due to tuberculosis globally. The response to COVID-19 can benefit or benefited during the pandemic from the capacity building which was done over many years for tuberculosis, like infection prevention and control practices, contact tracing, household care, community care of the TB patients, then surveillance and reporting system or monitoring system for tuberculosis that can be utilized for COVID-19 pandemic. As mode of transmission of COVID-19 and tuberculosis are almost same, and it is mostly airborne infection in both cases, although there is a slight difference in the mode of transmission. Administrative, environmental and personal protection measures apply to both COVID-19 as well as tuberculosis. TB lab networks, specimen transportation mechanism could be used for COVID-19 also, which were earlier being used for the tuberculosis. Various staffs like clinicians, laboratory technicians and nurses which were working in the TB control program can be utilized for control of the COVID-19 pandemic. Various digital technologies like used in the TB program can support the COVID-19 response, including adherence support, electronic medical record and e-learning like telemedicine, etc. Public health campaigns and health education which were used in COVID-19 pandemic can be utilized very well for TB control program also, like infection prevention and control practices, for example wearing face masks, frequent hand washing, then social distancing, which were widely publicized during the COVID-19 pandemic. They can be utilized for control of infection with tuberculosis also, and other education media through which the COVID-19 awareness were created, like television, social media, etc., that can be utilized for infection prevention and control practices for tuberculosis also, that will lead to the decrease in the TB transmission in the community, and we can control the TB as per our target of eliminating TB by 2025. We have learned so many things with the COVID-19 pandemic, and based upon that, we can utilize that information for making TB patients aware regarding the infection prevention and control practices. So all diagnosed TB patients should be made aware that how infection can be prevented from them to the household contacts near or in the community. So practices like face masks, social distancing to prevent the transmission in the household close contacts, and where they are working in those close contacts. Second thing, early detection. Patient and patient's attendants or family members should be made aware that what are the early signs of tuberculosis, like if they are having cough for more than 2 weeks, fever, anorexia or loss of appetite or loss of weight, or blood in the sputum, then these are the warning sign for tuberculosis, and person having these symptoms, they should seek the medical advice in the nearby health center as early as possible for early detection and treatment of tuberculosis. These patients who are initiated on treatment, it has been seen because the TB treatment is long treatment, so most of the patients stop treatment in between or default on this treatment. So they should be made aware that it is very important to complete the 6 months or 24 weeks treatment for tuberculosis, and they should not miss any dose of tuberculosis, otherwise that can lead to the failure of the treatment. If any patient develop any adverse effect of this treatment, they should seek the nearby medical care or at the health center, so that most of these side effects are minimal and they can be controlled just with the reassurance to the patients or symptomatic treatment. Now there is role of treatment, TB preventive treatment or TPT also. Patients who are the close contact of the TB patients, they should be screened first for active TB, and once active TB is ruled out, then these patients can be given treatment for TB infection in the form of TPT or TB preventive treatment as per the local national guidelines. Once these patients complete the treatment, they should be followed up closely every 6 monthly for next 2 years, so that if these patients develop a relapse, they can be detected early and can be treated.